Good evening, everyone. You are welcome to the webinar for today. It's our very first webinar here at Doktorconnect, and we are glad to have you here. So by means of introduction, I'm Dr. Ben Oko with Doktorconnect. I am a medical doctor who is passionate about creating awareness and prevention of diseases at the community level. And so just as Favor has said earlier, our very first 10 attendees residents in Lagos, you get free food scan, and then the details of this will be communicated later to you via email. So really, who is Doktorconnect? What do we do at Doktorconnect? Doktorconnect is a subsidiary of the Just Small Group and is a foremost telemedicine organization, and we are on a mission to use mobile and disruptive technology to make healthcare instantly accessible and affordable. So we also offer 24/7, that is round-the-clock telemedicine consultation via the Doktorconnect app, which can be downloaded via the App Store or Play Store. You also get first 30 days free. So you must have seen some of our content shared via WhatsApp, our social media pages, or even sent to your emails. If you haven't, kindly check out our YouTube page. It's called Doktorconnect, that's Doktorconnect, to get enlightened on general health topics like malaria, drugs that are safe for use in pregnancy, how to care for your vagina, and so on. So, to the agenda for the day, I'm sure we've all heard of hypertension or high blood pressure as it is popularly called, but do we really know what it entails? So the purpose of this webinar really is to enlighten us on the subject matter and equip us with better understanding of how we can care for our hearts in a busy world. I mean, statistics by the World Health Organization have shown that working more than 55 hours per week increases the risk of heart disease by about 15% and stroke by about 35%. And we can all agree that this number of long hours is not far-fetched, especially in a country like Nigeria. And that is why this webinar is really important to us. It has also been shown that from study globally that 1 in 4 men and 1 in 5 women have hypertension. So if you should do a rough calculation, there are about 10 people on the webinar, 5 males, 5 female, 2 already have hypertension. That is why this webinar is important to us. So quickly, a 180 seconds video on hypertension awareness that we did recently at the Computer Village Ikeja will be played now. We're able to screen over 300 individuals and manage as appropriate. We're also able to investigate some of the hypertensive risk factors as you will learn over the course of the webinar at our lab facility at Alausa. So the video will be played shortly. Kindly pay close attention. Thank you.
Know more about their numbers. We are here today to enlighten people about their blood pressure, to know more about their numbers. We are having a free blood pressure check for the masses of Computer Village.
We all run around for money, but we forget checking our health. I won't lie to you. I pay least attention to my health just because I run after money. While many people are paying attention to their wealth, most people are not paying attention to their health. And that's why today at Doktorconnect, we are here at this very hub to offer free checks for people to know the state of their blood pressure, to know the state of their heart rate, to consult a doctor, all for free, so people can know what's up with their health and they can take action.
Actually, I've not checked my blood pressure since I was born. With what the doctor just told me now, I feel it's more important for me to be doing that regularly.
And I think Nigerians should all adopt the way they are doing these things. We should all get online to make an appointment with our doctors and to connect with our doctors at any time.
You know, Doktorconnect is about increasing the average Nigerian's accessibility to healthcare. So it's not enough for us to give you that access on our app. We're also bringing it live to you on the streets, and that's what we're doing here, checking people's blood pressure, counseling those with high BP, and even those that don't have high BP, who have other health issues. We talk to them, counsel them, basically, and we're also activating our app for them, so they have access to doctors even after leaving this place.
Doktorconnect is all we need now. Looking at the rate at which people die in this part of the world, I think all areas of life we need to subscribe to at least see a doctor. This is an opportunity for us to let the whole world know that Doktorconnect, you can talk to a doctor through your phone online without going to the hospital.
Okay. I'm sure we all found that
Nearly
video.
It's very important to know your numbers. Really, if you don't check your blood pressure, there is no way you would know even if the blood pressure is normal or if it's even high. Today, we've seen people with BPs of 190, systolic blood pressure of 190, and that's an hypertensive urgency already.
I never knew I have a 2-bit high blood pressure, but now I need to see the doctor so that I can regulate and give me the prescription which I will use to regulate everything. It's going to be a continual thing, coming to the hospital to check my blood pressure and other things concerning my health.
I've been able to know some things and then to know further. I've been introduced to some things, and I intend to pay for some plans for not just me, my parents as well. Yeah.
Guys, I benefited because my eczema is 100%. I can also check my head in my phone. So you guys are doing well.
Right now, as you listen to my voice, open your respective app store, Play Store, just search for Doktorconnect, download and register. It's free for the first 30 days. Access quality healthcare at your comfort.
I'm sure we all found that video quite informative. So we are all encouraged to put out tweets with the hashtag care for your health as we go along. So the hashtag is hashtag CAR4 as in figure 4, your heart, hashtag care for your heart as we go along this webinar. And so before our keynote speaker comes up, a poll has been created to see what we think generally and what we know of hypertension. So if you kindly check your screen now and then choose an option. So just select one answer only. So a brief introduction of our keynote speaker, Dr. Benjamin. He's a graduate of Obafemi Awolowo University with 13 years progressive practice in clinical medicine and 6 years experience as a cardiologist. He has a Master's of Science in Pharmacology from the University of Lagos and has worked in First Cardiologist Consultant in Ikoyi, Lagos, and a host of other hospitals. He's a visiting cardiologist to many hospitals and currently works in the Department of Cardiology, General Hospital, Bagada. He'll be opening the webinar today on how to care for your heart in a busy world. If you have any questions, do leave a comment and we'll take them during our question and answer session at the end. Dr. Benjamin, over to you, please.
Thank you very much, Dr. Glory. Good day, everyone.
Good day.
It's good to have you on this webinar. To start with, I want to ask you a question. How did your week go? Was it stressful? Or was it pleasurable? This evening, we want to look at something that has to do with our lifespan as individuals. We're looking at the topic that says caring for your heart in a busy world, how to manage and avoid high blood pressure. Irrespective of how busy you are, whether you are very busy type or you are not the busy type, so to speak, or you are like me, that my wife once described as for me busy. I really remember one time we were busy working at home and the work was so hectic. I found that I was just moving from one place to the other. Actually, wasn't doing much. My wife was doing most of the work. And got to a time my wife whispered to me and told me that, oh, yeah, I can see that you are forming busy. But I told her, I've been working, I'm tired. I've been working. But she told me that I've been forming busy. Whether you've been busy or you've been forming busy, we really need to understand something, that we live in a very busy world, so to speak. A lot of people have come to attribute our busyness to the fact that we are in a COVID-19 era, so to speak. But let me quickly clarify something, that the world has been experiencing tight, busy schedules even before the pandemic. There is a world analytic body called the Gallup. In 2006, they come up with a statistics that showed that 25% of adults worldwide were under intense pressure and stress from busy schedules, from demands that are neck-breaking, and they also others. But as high as that statistic was, thereabout, in 2019, just a year prior to the pandemic, it was observed that the percentage has shot up from 26% to 35%, which is alarming enough. Now, come to the time of the pandemic, when COVID-19 came on board, and then we all know what we've been going through since COVID-19. COVID-19 has just compounded the stress level or the busyness of our world. Pressures on businesses, pressures on the economies of nations, nations having economic meltdown, and some have not even recovered in the process. How about the stress and tension on the families, so to speak, thereabout, is being extremely hectic. Families stranded, some stranded in a place where there is lockdown, they can't join their peers. How about people losing their loved ones as a result of the pandemic? It's been really hectic. But we need to understand something, that while the pandemic is easing in some countries, so many people are trying to capitalize on the fact that the pandemic is subsiding, and they want to make ends meet. People running at and scatter just to be able to make something out of the wasted years or wasted months, so to speak. But in the process, I found out that a lot of people pay for what they want to get with their health. Because the currency with which you use to get what you want is your body. If you are not fit, you can not get what you want. And this evening, please, I just want you to be relaxed. Take your pen and papers. If you have questions, let's talk about how we can care for our heart in a very busy world. And then with emphasis on how to avoid and manage high blood pressure. And I quickly want to say one or two things about your heart. I don't know, can you see me where you are seated? Can you see me? Yes, if you can see me, I just want you to do something quickly. Can you place your right hand across your chest, just below your left shoulder? I presume you are doing that. Are you doing that right away? Good. Good. If you're doing that now, without moving your right hand, can you make a fist? Can you make a fist? Okay, Dr. Gloria, just below your left shoulder. Can you see my hand? It's not touching the top of my shoulder, it's just below.
Okay.
Your right hand, then this. Good, thank you very much. I can see more slides now. Good, good, good. Now make it, without moving the right hand, just make a fist. Make a fist. Can you see me? Make a fist now. Good. Dr. Gloria, you're doing very well. Now, the size of my fist is approximately the size of my heart. Did you get that? What does that mean? It means that the size of your fist is approximately the size of your heart. So if your fist is big, it means that your heart is big, and vice versa. Are you with me? Now, just look at the size. As tiny as that organ is, it's one of the most vital organs in the body that needs to be taken care of all the time. Now, as small as it is beating at the rate of 60 to 100 times in a minute. In a day, it's beats at the rate of 115,000 times. Even when you are sleeping, the heart is not sleeping. It keeps beating, it keeps working, pumping out blood to all the parts of the body. Are you with me? Now, let me tell you something about this tiny organ that we trivialize, that we put under pressure because we want to make both ends meet. Thereabout. It pumps an average of 2,000 gallons of blood every day. Now, you want to ask, what is a gallon? Good. Just picture a keg of mobile engine oil, the 4 liters. That's approximately the size of a gallon. Now, the heart pumps 2,000 capacity of such containers in a day. As you can see, it's so industrious. It keeps doing so many things, and we keep stressing it. And let me tell you something. Whenever you push yourself under so much intense schedules and you stress yourself, the heart is one of the major organs that are affected in the body. Take, for instance, when you are tense, you're anxious, you find out that your heart is beating fast, it means that the rate with which the heart is beating goes beyond 100, meaning it's working more. When the blood pressure rises, the heart is made to pump more blood at under intense pressure. Now, as much as that is, heart-related diseases are the #1 cause of death all over the world. Let's move on. When we're talking about heart-related diseases, which we're going to talk about in the next few minutes, high blood pressure, that is hypertension, is the #1 cause of heart-related diseases, which means if we are able to avoid or control high blood pressure, then we can as well increase the lifespan of our heart or make our heart healthy. Are you with me? Thereabout. Now, quickly, other common causes of heart-related diseases in Nigeria, which I'm going to talk about shortly, is heart failure. What does it mean for the heart to fail? The heart fails when the amount of blood that it pumps does not meet the demands of the body. Don't forget, one of the major functions of the heart is that it pumps blood around the body. It pumps blood to the brain. That is why you can talk and reason and make constructive statements. It pumps blood to the digestive system. That is why when you eat, the food undergoes digestion and you're able to let out the waste. It pumps blood to the kidney. That is why you can make urine. It pumps blood to your legs and feet. That's why you can stand up and take a walk. Now, when the amount of blood that the heart pumps does not meet the demands of the body, we say that the heart has failed in the discharge of its duty, and that is what is called heart failure. We are going to talk more about that. Now, how about heart attack? Heart attack is what is also called, in medical parlance, myocardial infarction. That is, a segment or a portion of the heart muscle dies as a result of shortage of blood to that portion of the heart muscle. Then cardiomyopathies. Cardiomyopathies is a problem of the heart muscle, which can either make the heart to be flabby, that is dilated, or can make the heart muscle to be extremely thickened, or it can make the heart to be less compliant when it's taking in blood. And all these things can affect the function of the body. There are many of them which we're going to talk about during the course of this discussion. Now, Doktorconnect has come to take your doctor close to you, to awaken us to the reality on ground. Why do people die untimely? What is the cause of sudden death? Why do people have some predicament with their day-to-day living? Why are people incapacitated by heart-related issues? And that is why Doktorconnect is there. You can talk to your doctor. You'll be given constructive information. You'll be asked to do the right thing. You won't be misled in any way. And I can tell you, you're going to get the best from Doktorconnect. Now let's move on. We need to understand what is called signs of heart-related disease or condition. Peradventure, you'll be having some of these signs and you trivialize them. It's time for you to look at them. Or you know of a relative that has that and they just say, oh, it's just one of those things there, but we just move on. Or maybe when you are stressed, you have some of these symptoms and you think that just because I'm busy, so to speak. Now, we want to look at them one after the other. Please, I want you to give rapt attention to what I'm going to talk about this evening. If you notice there is a family member that has unexplained death or sudden death before the age of 65, it could be a sign of heart-related disease, which can be transmitted to members of the family. According to the American Heart Association, the existence of cardiovascular disease or condition before the age of 65, which is termed as untimely cardiovascular condition, is a risk factor for other members of the family. And that is why I keep telling when I see my patients and I try to take their family history and I ask, how is that? That you get a response that is late. When did he pass on? He was 55. You have an idea what was responsible? No. And if you didn't make inquiries, it is something that you should know. You must know if it was a natural death, heart-related death, or traumatic death. You should know how someone passed on in your family. It gives you an idea, it gives you an enlightenment. You will be able to beat your recurrence of such. That's number one. Number two, if there's a family history of heart attack or what we call coronary artery disease before the age of 65, you should try to talk to a doctor. When we're talking about coronary artery disease, it's an umbrella of disease that affects the heart muscles because of the narrowness of the blood vessels that give blood to the heart. As I said earlier on, the heart pumps blood to every organ of the body. It also gives itself blood. And there are some blood vessels or pipes that connect blood to the heart muscles, and we call them coronary arteries. Now, some of these pipes or vessels, they can be diseased. Some of them can be blocked by cholesterol or fat. Some of them can be blocked by a blood clot. And in the process, there is a reduction in the blood supply to the heart muscle. We call this coronary artery disease. And we are going to know more about the symptoms in the course of this webinar. Let's move on. Now, if you look, another warning sign of heart-related condition or disease that if there is family history of sudden death before 65 years, e.g., you just heard that somebody slumped or somebody went to bed and didn't wake up and was otherwise fine before going to bed, please don't trivialize that. You need to talk to a doctor and have your heart checked, because some of these can be inherited from siblings, from parents, and from other family members. Now, another warning signs of heart-related disease, which so many people have, is what is called palpitations. What is palpitations? Palpitation is when you are aware that your heart is beating. Some patients will say, my heart is racing fast. Some will say it's as if a horse is kicking on my chest, or it's as if somebody is drumming on my chest. It's what is called palpitation. On a normal day, you are not meant to be aware that your heart is beating thereabout. Now, when your heart is beating fast, don't trivialize this. Do you know why? When the heart beats erratically, what we call palpitation, it can be an avenue for a blood clot to be formed in the heart. When this blood clot forms, it can travel to other parts of the body, like the brain, causing what is called cardioembolic stroke. It can as well travel to the eyes, causing what is called sudden blindness. It can travel to other parts of the body, like the legs, and you find out that sometimes you can't perceive sensation in your leg. It could be from the heart, so you need to talk to a doctor. How about fainting spells? You find out that you're just losing your stamina, you're just having this dizziness, you're fainting. It could be a sign of heart-related disease. Now, when we're talking about another warning sign of heart-related disease, what is called chest pain. Please, I'm going to emphasize this because a lot of people with sudden unexplained cardiac death, they actually have one or two warning signs, but they trivialize those symptoms or signs until something more sinister happened. When we're talking about chest pain, this is how you can know that the chest pain may be heart-related. Number one, chest pain is very common in people. Some are friendly, some are not. Those that are friendly may be from the muscles and bones of the chest. When the bones of the chest, I want you to understand that there are some bones on the chest, we call them ribs. They overlie another bone in front of our chest. We call that one sternum. Those ribs mingling with the sternum can be inflamed. We call that costochondritis. It's the #1 cause of chest pain all over the world. And that's one of the reasons why many patients come to the hospital. Doctor, I've got pain in my chest. Now, when you notice that you have a pain in your chest, that is usually worse with activities like when you walk over a distance of 100 meters or 200 meters, you have pain in your chest. And when you relax, the pain subsides. It could be that the pain is from the heart. That is the dangerous type of chest pain. Number two, when you are anxious or when you are not. Simply, if I take, for instance, somebody just got you pissed off. And as in the process of talking thereabout, you find out that there's a gripping sensation in your chest. It could be that the pain is from your heart. When you want to climb 2 flights of stairs and you find out that the pain is worse, and when you rest, the pain is less. It may be from your heart. Also, when you use a drug, there's a drug called glyceryl trinitrate. It ensures that there's adequate blood flow to there. Some people have access to it. When you have chest pain and when you use this drug, the pain subsides. You need to talk to a doctor because it may be a warning sign of an imminent heart-related issue. Now, when you get unduly tired on minimal exertion, e.g. walking over short distance or climbing a flight of stairs, it could be that your heart is diseased and you need to talk to a doctor because your heart pumps blood when you are active. Take for instance, before now you could get in from your car, you climb 1 or 2 flights of stairs to your room, and then you don't even feel it. But now, the moment you climb the flight of stairs, you start panting unduly. You need to talk to a doctor. You need to find out maybe it's from the heart or not. When you notice that your legs are swollen, it may be a sign of an heart-related condition. Don't trivialize it. Talk to a doctor. Now, many things could cause leg swelling. Take, for instance, when you are not active, when you are immobile, you are sedentary. You find out that maybe when you stay for a long time, you have swollen legs, and when you walk, the swelling resolves, so to speak. But if you notice that it's always there, or it's getting more worrisome, to such an extent that when you press the leg, it pits, you need to talk to a doctor. It may be a sign of an heart-related issue. Now, when you cough have blood, what we call hemoptysis, is also a sign of heart-related disease or condition. Don't trivialize it. Don't say maybe because I have a little cold or something. Of course, it may be, and it may not be. It could be that there is so much water within the lungs that comes from the heart, what we call acute pulmonary edema. Number two, it can as well be that some of the valves of the heart has some gate or valves that open to some rooms, what we call chambers in the heart. Some of these valves, especially the one on the left side, we call it mitral valve, can be diseased, and it could be a pointer to hemoptysis. So when you cough out blood, let the doctor check and be sure your heart is fine. Now, when you feel pain and numbness or weakness or coldness in your leg or arms, don't trivialize it. Some may attribute it to arthritis of the neck, of course, it may be, but at the same time, it could be that blood is not going to the brain. It could be a sign of an imminent stroke. So you need to talk to a doctor. When you notice fainting spells, when you experience fainting spells, when you stand from sitting position to standing or erect position, we call this orthostatic hypotension. That is, you have been seated, and the moment you stand up, you find out that you are dizzy. Some will even faint. It is called hypotension. Do you know why it happens? Good. This is how it happens. When you sit, there is adequate blood distribution to all parts of your body. But the moment you stand, the effect of gravity pulls the blood towards your legs. Meanwhile, there are some veins in the legs that are expected to pull the blood back. When they fail in the discharge of their duties, the blood drops excessively to the legs. In other words, the blood pressure also drops. Then the brain feels as if it's not getting enough blood, so you get dizzy, or you may even faint in the process. We call it orthostatic hypotension. It is very common in diabetics, that is people with high sugar level in their blood system. We call it autonomic dysfunction. It's one of the things they have. Most times they get dizzy when they stand from lying or supine position to standing. You need to talk to a doctor. A doctor can see you and they can make some prescription for you. You can be given a stocking and you can be given some steroid that can help you, as the case may be. But you need to talk to a doctor. When you notice that you easily get tired, we call it fatigue. It could be a sign of an imminent heart-related issue. Then lastly, one of the signs of heart-related issue, when you just feel funny and you don't know where it's coming from, don't trivialize it. Go see a doctor. I've seen a patient who came into the hospital and her complaint was just a discomfort in her jaw. I just have this discomfort in my jaw, thereabouts. Then when we probed further, asked some questions, we found out that she had some risk factors for heart-related issues. So we did an ECG. What we saw on the ECG was alarming. She actually had a heart attack and she didn't have the classic symptoms. Then we took this lady to the lab to look at the state of the blood vessels that go to there. We call it coronary angiogram. We found out that 2 of our heart arteries were blocked in such a way that we had to put a stent in her heart. So sometimes when you feel funny, don't trivialize it. Don't say, I'll just go to bed. No. Just talk to the doctor. Let the doctor check you and be sure everything is fine. Now, the focus of our discussion today is blood pressure. And I must commend Doktorconnect for this program in this month, because every month of May, the whole world marks what is called World Hypertension Day. And it's a day that is set aside by the World Health Organization to remind people of the state of their blood pressure. And the theme for this year's World Hypertension Day is measure your blood pressure accurately, control it, and live longer. In other words, if you're able to measure your blood pressure accurately and you can control it, there is tendency that you will live longer because high blood pressure is the number one cause of death. Number one cause of heart-related issue, and heart-related issue is the number one cause of death all over the world. Now, well, what is this high blood pressure? I just want you to picture your pumping machine at home. Your pumping machine takes the water from the reservoir or from the well, pushes the water into some pipes that go into the reservoir, then circulate into the house. Now, the pumping machine is likened to your heart here, while the pipes are the blood vessels. Now, when we're talking about blood pressure, is that pressure or force that the heart uses to pump blood against the arteries to supply all other organs of the body, just like the water pumping machine does. It pumps water into the pipes and then the water circulates into the rooms or to the apartment. It is usually measured with a machine called the sphygmomanometer. It can be manual and it can be electronic. In fact, many people have the electronic one. That one is easy to use. In fact, there are some that are automated that they can talk and tell you whether your blood pressure is good or not. Now, when you measure your blood pressure, you see two numbers. For those of us who don't know this, there is a number on the top and there is a number below. The one on top is what is called your systolic blood pressure. The one below is what is called your diastolic blood pressure. Take, for instance, if someone's blood pressure is 118/68 millimeter of mercury, we say the one on top, that is 118, is the systolic, and the one below, 68 millimeter of mercury, is the diastolic. Now, I'm going to tell you more about this shortly. Now, when do we say that somebody has high blood pressure? Now, this is according to the American Heart Association and the American College of Cardiology, published in what is called the JNC7. When your blood pressure, the one on top, what I call systolic, is less than 120 millimeters of mercury, your blood pressure is normal. Now, when the one below is less than 60, we describe it as normal. Now, there's something we call elevated blood pressure. It doesn't mean that you have hypertension or high blood pressure. When the one on top, that is the systolic, is between 120 and 129, we say it is elevated. Then the diastolic, if it is in the neighborhood of 70 to 80, thereabout, we can say that it's elevated. Now, when we're talking about stage 1 hypertension, this is high blood pressure now. Systolic is between 130 and 139. And in stage 2 hypertension is between 140 or higher, thereabout. And when we're talking about hypertensive crisis, any blood pressure that with the systolic beyond 180 and your diastolic is beyond 120, we say the person has a crisis. Good. Now, high blood pressure is also known as silent killer. It's a silent number, but the number kills. It doesn't tell you, and so many times it doesn't send a signal or a warning sign, except there are established complications, or maybe what is causing the high blood pressure is related to a medical condition or disease. We will talk about that shortly. Now, hypertension is the single most important risk factor for heart-related disease worldwide. And in Nigeria, 1 out of every 3 adults you see has a high blood pressure. Unfortunately, 2 out of the 3 hypertensive in Nigeria are aware of their blood pressure. Now, out of the two thirds that are aware of their blood pressure, only 1 out of the 2/3 of those who are aware of their blood pressure are on medications. Now, let's come back to Nigeria. Hypertension is the number 1 cause of heart failure in Nigeria. As I said earlier on, heart failure results when the heart fails in the discharge of its duties. And it usually manifests itself as when you pant unnecessarily, when you do something strenuous, when you notice that your legs are swollen, when you notice that you can't lie down at night flat on your bed. When you lie down for a while, it's as if you are suffocating. You need to sit up. Sometimes you sit up and you take a recumbent position on your seat. Some people cannot even sleep on their bed again, but they sleep with their head on the table. And that is when they are comfortable. That is heart failure. Then when you cough, and when you keep coughing out whitish fluidish sputum, sometimes it could be bloody. Thereabout. It's a sign that the heart has failed. And you need to talk to a doctor. Number one. Number two thing is that hypertension is also the cause of, number one cause of chronic kidney disease in Nigeria. Chronic kidney disease is a disease of the kidney when the kidney fails to excrete waste product of metabolism. The kidneys are meant to let go of some waste products like urea and a host of others. But when the kidney fails, the body retains such and come with different types of symptoms. Take for instance, when you notice that you are not urinating as frequently as you used to, 2-3 days, not a single drop of urine, it could be a sign that the kidneys are not working well. When you notice that sometimes at night you easily wake up to go and pee, we call it nocturia. You need to check and be sure your kidneys are not in danger. Sometimes it could be leg swelling. Sometimes when you notice that your blood level is dropping to an abysmal level, you can't explain it. Sometimes when you have hiccups, you keep having hiccups and you can't explain what is causing the hiccups. It could be a sign that the kidneys are diseased, and high blood pressure is the number one cause of that in Nigeria. High blood pressure is also the leading cause of stroke in Nigeria. And something is alarming. This, I'm giving you first-hand experience from the emergency room thereabout, because we are seeing some incidences at an alarming rate, and we are going out there to sensitize Nigerians about what is going on. Many young people are coming down with stroke. People in their 30s, people in their early 40s, and these are the breadwinners of the family. What is stroke? Stroke results when there is a sudden weakness or malfunction of the body. Take, for instance, slurred speech. The speech is slurred, or someone is drooling the saliva suddenly, or someone cannot lift the right hand or the right leg, or somebody just goes blind, or somebody cannot hear. Thereabout. These may be signs of stroke. Sometimes it will come as a form of convulsion. Sometimes it could start with a banging headache, then convulsion, and it also others. It is rising at an alarming proportion, especially in the young. And high blood pressure is the number one cause in Nigeria. Then high blood, one of the things that you need to know about high blood pressure is it can cause what is called hypertensive retinopathy, which can be a cause of visual loss. So sometimes when you have issues with your eyes, it could be that because the blood pressure is high and you need to work on it and check it. Now, another thing that blood pressure can result is what is called metabolic syndrome. What is metabolic syndrome? Hello, can you hear me?
Yes, sorry to interrupt. We have about 5 minutes left.
Okay, thank you very much. Now, metabolic syndrome, it comes when there is abnormal sugar level in the body, then blood pressure is also high, and you are obese in the trunk. Then peripheral artery disease from thickened blood vessels can be one of the aftermath of high blood pressure. Then dementia, that is memory loss. Then what are the types of high blood pressure? There's something we call primary or essential hypertension, which is common. People in their 30s, people in their 20s, thereabout, it accounts for about 90% of cases, and it is likely genetic. The next type of high blood pressure is what is called secondary hypertension. This one results as a result of certain disease conditions in the body, like narrowness of the arteries of the kidneys, or cancers of the adrenal gland, or too much of cholesterol. Then there's another type of blood pressure we call office or white coat hypertension. That is, blood pressure rises when you get to the doctor's office, thereabout. There are ways with which we find that when you get to the hospital. And lastly, there's something we call masked hypertension. What is masked hypertension? Just like somebody putting on a face mask. You can't see the true identity of the person. The person gets to the doctor's office, the blood pressure is normal. But the blood pressure at home is high. It is what is called masked hypertension. And there are ways with which you discover this in the hospital. Now, what are the risk factors? The risk factors are divided into two. There is one we call non-modifiable risk factor, that is, you can't change this. Say, for instance, as you are aging, there's tendency that your blood pressure rises. Then when there's family history of hypertension, and let me quickly say this, if you track your family lineage, every Black person has someone in the family with a high blood pressure. Then the male gender also has tendency to have a higher blood pressure than the female gender. And then ethnicity is commoner in Blacks. Now, what are the modifiable risk factors? Which are some of the things that we can use to avoid high blood pressure? Smoking is a terrible factor. Obesity, that is, your body mass index is more than 30 kilogram per meter square. What is body mass index? When you check your weight, whatever number you get, also find your height in meters, multiply your height by itself, then put the weight on what you get as your height in square. If it is more than 30, you are obese. It's a risk factor that can be modified. Other modifiable risk factors include diabetes or too much of cholesterol, what we call hyperlipidemia. This can be corrected. Alcohol is also another modifiable risk factor because some of them, they have salt in them. Beer has salt in it. Then diets are rich in salt, such as energy drinks, they have a lot of sodium in them. Or there is this habit most Nigerians have. When you are served a meal and you find out that the meal is not salt enough, you add salt to your food on the table. It's a risk factor. There are some people, we call them type A personalities. They are always on the moving side. If they are somewhere, they're about, you will always hear them. They always talk. They want to lead. They want to be the first. We call them type A personalities. They are prone to high blood pressure. Then sleep disorders, like what we call sleep apnea. You sleep at night and you snore. It can give you what is called nocturnal hypertension. Then people that use oral contraceptive pills, they are at risk of high blood pressure. I've talked about the complication of high blood pressure the other times: stroke, heart failure, kidney disease, heart attack, hypertensive retinopathy. Then how can we maintain a normal blood pressure? Number one, you must know your blood pressure. Check your blood pressure at least once in 2 weeks if you are fine, and if you don't have a high blood pressure before, and then every day if you are hypertensive. Know your risk factors and reduce your modifiable risk factors. If you are obese, you can go to the gym. If you have cholesterol, the doctor can give you some cholesterol-lowering drugs. If you have sugar, the sugar can be corrected. If you're hypertensive, use your drugs regularly and make your doctor your companion. Eat well and healthy. Don't take too much of salt. Don't take too much of red meat, things that can worsen your cholesterol level. Then exercise regularly, 150 minutes of exercise every week. You can break it down. 30 minutes today, the next 2 or 3 days, 30 minutes. Try as much as possible to enjoy good sleep. Reduce stress. Don't be the workaholic. You go on vacation once in a while. Maximize your leave. Share your burdens. Don't put everything to yourselves. Excess luggage emotionally in your workplace. If you have people that you can delegate, you are a family woman, thereby you are nursing children, then you are taking a postgraduate program in the process, you still have your work there. You can get a reliable house help to take care of some of those things. Regular comprehensive check. Don't say that I hardly have any condition, I'm always fine. No, until your doctor says that, oh, after a comprehensive health check, you are fine. That is when you are fine. This is how to check your blood pressure. Check it regularly and use the right cough. Avoid dangerous drugs. We are seeing a lot of youth nowadays with a lot of drugs. They take all sorts of drugs, painkillers. Some of those painkillers can worsen your blood pressure. all those drugs. Don't ever use any drug without a doctor's prescription. And lastly, don't forget to pray. We have come to the end of this short presentation that is caring for your heart in a busy world, how to avoid and manage high blood pressure. Thank you very much. You can send in your question now.
No. You don't want you to show.
Thank you very much, Dr. Benjamin. I'm sure we all agree that that was a very lucid presentation, and we can confidently say that we know now on ways to care for our hearts than we knew before this webinar started. I know how precious our time is, and that is why we'll be brief as we can possibly be. We have over 15 questions for now. You can still drop your questions via the chat option, and then we'll attend to them after our second speaker is done. And so a poll will be placed now to introduce us to the next segment. If you would kindly answer and select one of the options on your screen. Thank you. As a way of introducing our next speaker is Dr. Diron Onifade. He's the Chief Medical Officer for Doktorconnect. He's a level 15 Principal Medical Officer in the Health Service Commission, Lagos State, and currently with the Lagos State Emergency Medical Service and Family Medicine in General Hospital, Lagos. He joined the Lagos State Health Service in 2009 and has been involved in several health projects set up by the various hospitals. He is part of the COVID-19 response team as his primary place of assignment. Dr. Diron is interested in developing the state of health in Lagos State via adoption of health technology and machine learning to drive the new trend of the profession in the country as a whole. We'll be taking us briefly on Doktorconnect Wellness Plan. As I've said earlier, if you have any question over the course of this presentation, you can also leave a comment and we'll go over everything with both the cardiologist and Dr. Diron at the end of his speech. Dr. Diron, over to you, please.
Okay, thank you very much, Dr. Gloria. Thank you so much. Can you hear me?
Yes, we can.
Okay, then Dr. Benjamin, that was a lovely presentation. It's like you took us to school and it was like the basis. Everybody that is not even in the medical line will understand what our disease are and what we need to do. That was very good. Thank you so much. Good eye opener.
Okay, sorry. Dr. Benjamin, can you please stop sharing your screen? Dr. Diron, you can continue. Thank you.
I want to try to share my screen. I want Dr. Benjamin to stop sharing the screen so I can share my screen. Okay. So let me share my screen. Okay. I will be talking about Doktorconnect and our offerings and what we are all about. Can we all see my screen? Can we see my screen? Hello?
I can see your screen, Dr. Diron.
Okay. Doktorconnect is a health technology company that is new right now in Nigeria, but not so many people might know the name now, but it's not going to remain like that for so long. I'm very sure in a few months from now, it's going to be an household name. A lot of us are going to know Doktorconnect, but I'm going to try as much as possible to focus what Doktorconnect is all about to what we are presented today, courtesy Dr. Benjamin and Dr. Gloria. So who are we in Doktorconnect? Doktorconnect is actually not alone. It's a combination of Doktorconnect and Life Pro. Doktorconnect is just the telemedicine part of the business, and Life Pro is one that offers the laboratory and imaging service, the medical devices, the test kits, and FDA-approved supplements. So we all know that the world is changing, technology is taking over everything, and it has come to a stage where it's not enough to say I'm a doctor. Even as a doctor, you have to be technologically oriented. You have to be big on the big data itself. You have to be acquainted to machine learning. You have to be acquainted to artificial intelligence. A lot of things are happening in that sphere right now that we doctors need to open our eyes to that. And thank God for Doktorconnect and the offerings and what they bring to the table. COVID-19 came and it taught us something that it is not just enough for us to just say we want to go to the hospital, we want to do everything in the hospital. Is there a possibility of bringing this experience into your phone, your laptop, and all that? If you stay in Lagos, you all know how stressful it is to commute, to move around and all that. So Doktorconnect has solved that problem. Almost everything Dr. Benjamin said can actually be experienced from your phone. What do I mean by that? Ordinarily, if you want to see a specialist like Dr. Benjamin, you probably have to go to General Hospital, probably have to go to Bagada to see him, you have to go to Igbondo to see him, you have to go to Lagos Island to see him, and a whole lot of that. But one way or the other, Doktorconnect have been able to bridge that gap and bring Dr. Benjamin and co very close to your phone. This is not the first time we are seeing things like this. The banks have done it, a lot of applications have done it. In the past, people have to go to the bank to go and collect tally number and queue before they can access the offerings of the bank. And what happened? There's a lot of change in that paradigm. Things changed so drastically. We can do so much on the phone right now. And the same thing Doktorconnect is bringing to the table. What do you do when you want to see your doctor or you want to go to the hospital? You get to the hospital, you collect you open an account with them by opening a folder, and they get to see you, they check your BP, they check your temperature, they check your sugar level, they check all those things. Then after they do those things, they take your file to either see me one of the residents, probably when the resident sees you and if you need to see a specialist like Dr. Benjamin, they forward to him and all that. What if those things can actually be done on your phone? What if they can be done on your phone? And that's what Doktorconnect has done for you. So we have been able to bring that experience of you getting to register. You can register through our electronic health record system, which is Lagos State is big on that right now. A lot of hospitals are trying to do that right now. We have been able to bring that experience. You register with us by downloading this application, either from your Play Store or from your App Store. You download it, you have it. And when you do that, you can actually see either our medical officers, they consult you, they are there 24/7, or if you need a specialist care, you can actually access them through this application. And we just don't stop there. We have devices through the Life Pro that you can actually get to test a lot of things. Apart from the wellness plan, we have all those things which I'm going to cover very briefly now. So before I go that, let me talk about our wellness philosophy. When we talk about the wellness philosophy, we have something that a mantra that we are so big on in Doktorconnect, and it is called nutrition, prevention, and intervention. We call it the 3 Shons. The 3 Shons, what are the 3 Shons? We all know that if you stop taking your food as your drugs, you start taking your drugs as your food. What do I mean by that? Everything starts from nutrition. If we get it right from the point of eating, we can solve quite a lot of problems. And we not get to a stage where we have to now start taking medication. I see a lot of people, like Dr. Benjamin said, 30s, 40s, 50s, we are seeing hypertension, we are seeing diabetes. The same person, we have hypertension, we have diabetes, we have everything, and take different medication at all the time. When you see these medications, you think they are food. The drug have become the food. But can we address this at the point of eating? Yes, we can. And that is why we at Doktorconnect, we are very, very heavy about that. You need to know the number of calories of food you are eating. Like we have heard about the DASH diet. The cardiologists are very big on the DASH diet. Family medicine people are very big on the DASH diet, that there's a way you take your food that is going to stop you from developing to the stage of hypertension and diabetes, even cancer and a lot of all those things. Everything starts from diet. So if you get to eat very well, you stop all these things from getting to hypertension, and you are not going to get to all those things. It's bad enough that most of us don't exercise. But can we eat rice? Yes, we can, if you put our mind at that. So how do you get to know the number of calories of food you are eating? That's why in Doktorconnect, we have this food scale. With the food scale, you can measure the amount of kilocalories in every single food you are eating. Is this the first of its kind in the world? No. but this is the first of its kind in African food. Normally, you have all those other diets and all that have the kilocalories in all this application and the weighing scale and all that. But for the first time in Doktorconnect, we bring to you your eba, your amala, your ofada, all these things. You can get the kilocalories of the food you need to eat. So maybe your dietitian have told you that what you need to eat is 2,500 kilocalories, but you don't know what is in the eba you are eating. You don't know what is in the amala you are eating. But with our food scale, if you put your eba on it, you know that, okay, this morning I've eaten 1,000 kilocalories. What is remaining for me for the rest of the day is 1,500 kilocalories. You can monitor these things from our food scale. So we are very big on nutrition. We are very spot on nutrition. We don't take nutrition slightly at all because we believe that is the first shun that we must take into consideration. Now let's move to prevention. Prevention, they say, is better than cure. America spends so much money on treating disease and a lot of all those. If you look at what they spend on the budget for health in America, our statistics in Nigeria is not so efficient, and we have missed a lot of things when you look at that statistics. If we can get it right at prevention, at that level of prevention, so many things will not happen. You probably will not have hypertension, you probably will not have diabetes. We are going to address you on what to do. And on prevention starts from you having to know your wellness. In the wellness plan, there's a lot of package that we have there that you know where you are at this particular point in time and you know where to adjust. Is my cholesterol level high? Do I need to go and see a cardiologist? Do I need to be on statins to remove some of these things? Do I need to exercise more frequently, or what do I need to do? That is where prevention is better than cure. If you're able to address it at this prevention level, it's not going to get to that stage where you need to spend so much money. Guess what? It is very, very cheap. You are not just helping yourself when you take this prevention very seriously, you are helping the government because the budget on health that you are spending is so high. So at the preventive level, we can do so many things. Doktorconnect is here to help us with that through our wellness plan. As at the time we are getting to intervention stage, intervention is very, very expensive. If you go to dialysis center, see people doing dialysis, that is the intervention stage. People are spending so much. These things are not cheap. It costs a lot of money. By the time you need to do a stent, you need to go and see Dr. Benjamin, you are going to spend a lot of money. Can we prevent it from getting there? But guess what? If you have even missed it at this stage and you get to intervention level, we have bouquets of doctors everywhere, both in Nigeria, outside Nigeria, where we can help you solve all this problem. We don't want you to get to the intervention stage. We want to solve it before you get to that stage. But even if you get to that stage because you are not well informed, because you are not well educated, in totality, we at Doktorconnect are going to solve that for you. So that is the wellness plan, that is the nutrition, the prevention, and the intervention. Let us take these three things very, very seriously. So I move on to my next slide. What are the range of our offerings? We have the telemedicine. Like I said, the telemedicine is where you can talk to doctor any time of the day. Why do you need to enter traffic to go that far? Why don't you just download these things on your phone and get to see your doctor? If you download this and you get any of our devices, the 6-in-1 itself, we check your temperature, your SpO2, that's your oxygen level, your BP, your sugar level, your mood analysis. And guess what? This thing is going to be automatically uploaded to your doctor anywhere the doctor is, no matter where you are. Your doctor sees these readings, and he advises you that, old man, this is what you have, this is what you need to do. You need to get a medication. And the game again changes because you don't even have to go out to go and get these medications. We have arrays of pharmacies that they can bring these medications to your doorstep using our telemedicine application. Our annual wellness check, what do you get with the annual wellness check? There are 3 packages of the annual wellness check, which I'm going to get to in the next slide. With the annual wellness check, you can get to know things before it happens and you tackle it immediately. Still, we are talking about prevention. Then the devices, we have about like 3 to 4 devices that does a lot of things. We have, and all of them are going to be highlighted in the slide I'm going to share. So this is the telemedicine app. What do you get with that telemedicine app? You have optional home visit if you want. You have access to wellness checks, online prescription, like the way I mentioned before. Online prescription, like the way I mentioned before. Sorry, let me go back to that slide. Sorry. Okay. Okay, so that's the telemedicine. We have unlimited access to doctor. We have libraries where you can access exercise to do. A lot of people register in gym and they don't go. We all want to say, okay, I belong to this gym, I belong to that gym, but do we actually go to this gym? We don't go. But in our application, we have self-instructed exercise that on your own you can DIY. Just in your living room, you can just say, okay, what I want to do today is aerobics. You do your aerobics right there at home and you attain the result you need to achieve without you having to go far. People are busy everywhere. We know that. We know that people are busy. Before you go to your, maybe a lot of people live out maybe 5, 6, they work in the bank, they stay maybe in a condo, they work on the island, they want to rush to work. But before you leave, self-instructed exercise, you can do this in the morning or maybe when you get back before you go to bed. And guess what? We have seen that you just need to do maybe 30 minutes of this exercise, probably 3 to 4 times in a week. It doesn't have to be every day. With our application self-instructed, you get all of that. And we even give you an accidental insurance if you do any of this package. That means if anything happens to you, probably Okada accident and you need to be admitted in the hospital, Doktorconnect give you an accidental insurance that covers that. That is unbeatable. Nobody is offering those kind of package in Nigeria presently. So the annual wellness check can check your heart issues, kidney, your biological age. What do we mean by biological age? Some people are 30, but their cell age is already looking 50. And they will say this person just died all of a sudden. Nobody knows why. Artificial intelligence and machine learning have solved that. We can actually, because of data, we can actually check your cell age and know that this man is 30, but your cell age is 50. Then we now recommend the things you need to do. Do you need to be heavy on exercise? Do you need to be heavy on your diet? Do you need to refer you to see a cardiologist? Do you need to see an endocrinologist? We now refer you appropriately to the people you need to see without you having to go far. We have our joint analysis. The joint analysis machine is very, very interesting. Joint pain, back pain is quite a lot. A lot of elderly people have back pain. It's very common. Back pain and falls are very, very common in the elderly age group. You just see them, they fall all the time. You see them, they have back pain all the time. People have used so many analgesics, which we have all heard from Dr. Benjamin to that this can actually contribute negatively to your health. And guess what? The problem with that joint pain or the back pain might just be your posture. Might just be because you are not sitting rightly. Might just be because you are not sitting rightly. So because of that, we need to exercise so well. We need to do our test to know this joint analysis and we get every on that. So that is the way that is. Then we have our obesity, our urinalysis analysis, and all those things. We have all those things, your cholesterol check, your posture check, your body composition analysis. Dr. Benjamin mentioned something about, sorry. No, not yet. Okay, it's charging now. No, it's not charging. Sorry. I need to charge my phone. There's something about the body composition analysis. The body composition analysis compared to the BMI, there are two different things. In the past, what we would use to measure this thing is BMI. And research have shown that the BMI is actually not a true measurement of how obese we are. There's a lot of documents, there's a lot of papers that show this. We need more than the BMI because what does the BMI actually measure? It measures your height against your weight and is a square of that. That's what the BMI.
Dr. Bira? Okay, it looks like we're having some connectivity issues with Dr. Diron. While we try to get him back, we would move to our question and answer segment. And so some of the questions we've had so far, Dr. Benjamin, one of them says, is it true that body types could affect the normal ranges of different people's blood pressure?
I'm sorry, doctor, I didn't get that question very well. Body types?
Could body types affect the normal ranges of different people's blood pressure?
if I may understand, what does she mean by body types? You're talking about the weight?
Yeah, the weight, if it's pear shape, those different types of shapes.
Okay. As much as possible, we respect everybody's body type or shape, irrespective of your weight or your shape. We respect your size and your weight. But what we are concerned about is if you are overweight, from the BMI index or from body composition index, like as Dr. Duran said, if it is beyond certain parameters, we say it is abnormal. Of course, obesity is a cause or is a risk factor for high blood pressure. In fact, apart from high blood pressure, there's another type of hypertension, what we call pulmonary hypertension. What that means is that your heart is closely linked to your lungs. Blood moves from the heart to the lung and back from the lungs to the heart. In people with obesity or with our overweight, thereabouts, there is so much pressure on the right side of the heart, which can build up the pressure that can affect blood flow to the lungs. We call this one pulmonary hypertension. So apart from being a risk factor for systemic hypertension, is also a risk factor for pulmonary hypertension. Maybe I need to hand over to Dr. Johanna. Is back.
Okay. Dr. Jehovah, to you, please.
Okay, so can you hear me?
Yes, we can.
Sorry for that break in transmission. So I am at the point of the body composition analysis. So I'm talking about the body composition analysis versus the BMI. So the BMI is just the weight and the eyes, and it doesn't account for a lot of things. It doesn't apply for the visceral fat. It doesn't apply for the bone mass. It doesn't apply for a lot of things. And for so long, this is what we doctors have been using to judge those who are obese and those who are not obese. So quite a lot of papers are coming out right now that either than using the BMI, everybody should now start using the body composition analysis. Although it is easier and more convenient to use the BMI, but with the body composition analysis, it's going to change the game. I might be slim and I go on the weighing scale and it tells me that my BMI is fine. But meanwhile, my cholesterol might be high. Meanwhile, my bone mass might not be fine. Meanwhile, my water content might not be okay. So these are the things that the BMI itself does not account into. Doktorconnect has been able to address that. So we just don't judge who is obese, who is not obese, and all that because of BMI alone. We use your body composition analysis to change that. This is going to change quite a lot of things. This is going to let us discover a lot of ailments, a lot of hyperlipidemias, a lot of things before you get to the stage where we need intervention. Prevention is going to be key by using this body composition analysis. We have a skill for that. Our smart intelligent weighing scale using artificial intelligence addresses the whole of that. You don't have to rely on your BMI anymore. Just go on this thing and you get almost 12 parameters that list all these things: your bone mass, your fat level, your height, your weight, all those things going to be listed. And you know if my cholesterol level is high, if your bone mass is high. A lot of people stop exercising because they have done it, they are not losing weight. They keep wondering that, why am I not losing the weight? They get discouraged, they stop doing it. But because they don't know that before you get to the stage where the weight is going to change, quite a lot of other things are going to be adjusted in the system. Via the body composition analysis, you are going to see this. You know that although this has not resulted into a digital weight loss for me, but I can see that my water level is getting better. I can see that my cholesterol level is increasing. And this gives me a reward system for myself to continue that with my diet program or my weight loss program. And people like reward. When they see that this is good, they continue. And before you know it, they get the results that they want. So that is what the body composition analysis is going to do. That is the 6-in-1 that I've explained before. Then the body composition analysis is what then the full scale, I've talked about this, our rice, our father, our toe, and all those things come into that. So how do you get all these our beautiful devices? How do you come in and get these our beautiful devices? We have 3 of them. We have the Life Pro Mini, the Life Pro Plus, and the Life Pro Max. The Life Pro Mini is very pocket friendly. A lot of tests that people are going to go to the lab for, and they are going to spend 100,000, 200,000, 350,000, and all that, you can get all these wellness check, our 8-point annual wellness check, plus 1 year subscription via telemedicine, our Doctor Connect, access to our fitness, you get it with just 40,000 naira. And guess what? Before someone develops stroke, they are supposed to start having narrowing of the coronary vessels and the abdominal aorta. You are going to have plaques collected in all those places. And nobody checks all these things, as simple as they are. All you need to do is just put a probe in here and check the width of these vessels, and is there plaques in these vessels? People don't check these things. This is going to make the cardiologists to be seeing unnecessary things they are not supposed to be seeing if we detect this thing early. And we know that, okay, this person needs to be on statins. This person needs to be on lifestyle modification. So with all this Life Pro mini plan, you get to do all those tests for just 40,000 naira with 24 other parameters that we are going to check for you. And you are going to get the result checked to you. Your doctor is going to see, they are going to advise you. You are going to be able to talk to a doctor for the Life Pro mini package. Then the Life Pro Plus come with the food scale and the intelligent weighing scale. The food scale will know you, let you know the number of kilocalories, and the intelligent weighing scale let you know the body composition analysis. And guess what? The Life Pro Plus is with the Life Pro Mini. That means you are still going to do the annual wellness plan. You get that for just 80,000 naira. Is ideally, if you want to do this, you are going to probably spend like 400,000, 500,000. But because Doktorconnect is trying to make this thing affordable to the masses, we put it at 80,000 naira, plus you talking to a doctor any time of the day. And that includes, you can actually get to see specialists on our platform. Apart from the fact that you can take to medical officers anytime you want to. And we go to the Life Pro Max. The Life Pro Max is where you get the 6-in-1, you get all the device. You get
Sorry,
all
Dr. Adira.
Yes?
Can you scroll down a bit so we can see the pricing, then just remain on this page? Yes.
Okay, can you see it now?
Yes. Yes, we can.
Yes. Okay. So 40,000 naira for the Life Pro Mini, 80,000 naira for the Life Pro Plus, and 200,000 naira from the Life Pro Max. The Life Pro Max, you get all the offerings: the 6-in-1, the body composition analysis, the full scale, your wellness plan, consultation of a doctor, optional if you want a visit, you can choose the whole of that. The insurance plan that we have, you get everything with the 200,000 package. So those are the 3 plans. Other plans are going to be unfolding. We are preparing a plan for hypertension and all that. That is going to come on the table, which we are going to send out to everybody very soon.
Thank you very much. Thank you very much, Dr. Jero. Okay, thank you. So we'll go over some of the questions we have with Dr. Benjamin. So a participant is asking, at what age is one prone to having high blood pressure? So let me take two together so you can answer them. So the first one, at what age is one prone to having high blood pressure? While the second person wants to know if there are any teas around that are effective for lowering blood pressure.
I'm sorry, I didn't get it. The second question, Dr. Gloria.
If there are any anti-BP teas that are effective, okay. Yes.
Okay. Thank you very much. High blood pressure does not have an age demarcation, so to speak. I've seen a patient who is 15, 16, 17 with high blood pressure. But in the young, there is usually an underlying cause. And one of the major causes in this environment is what is called chronic glomerulonephritis, issues with the kidneys. So when we're talking about the age, it can come at any time, even in the young. People in their 20s, I have so many patients, in their 20s, they have high blood pressure, 30s, and we have some under 20s with high blood pressure. So it doesn't have any age band, but it's commoner in the elderly. As you are aging, there's tendency that your blood pressure rises because your arteries are thickening up, what we call arteriolosclerosis in medicine, thereabout. Then the second question, that is T, thereabout. You agree with me that as doctors, we do not advocate use of herbal preparations and a host of others. As far as that is concerned, thereabout, it has not been proven there are certain things you can take to lower your blood pressure, apart from recommended medications. Thank you.
Okay, thank you very much, Dr. Benjamin. So another question here. I checked my BP last week and it was elevated. It has then created anxiety in me and has gone as far as 150/90. And I've been really worried as I'm now having stabbing sensation on my left jaw. What can I do?
Very good question. When you check your blood pressure is high, you don't have to be worried. So you just need to calm down, because your blood pressure can, even in people that have high blood pressure, they may check their blood pressure at a time and the blood pressure goes up. Take, for instance, if you have just exercised or you are under so much pressure, it doesn't mean that your blood pressure is high. In fact, the current recommendation for diagnosing high blood pressure, according to the American Heart Association, is what is called 24-hour ambulatory blood pressure monitor. You get a blood pressure machine with a device that keeps tracking the blood pressure. You go home, you go to your office, it keeps checking your blood pressure. After 24 hours, we extrapolate the numbers, find the average, and then calculate your average blood pressure. So if you check your blood pressure once and it's high, you don't have to be worried. What you just need to do is talk to a doctor. We have to recheck the blood pressure. If we now find out that it is persistently elevated, we want to find out what is causing that. Then you need to be, if you need to be on drugs, you need to be on drugs. But our first line approach in the field is not all drugs. Blood pressure is high and then we give drugs. There are certain things, what we call lifestyle modifications, like what Dr. Dana talked about, your diet, you may need to modify all those things, and then you have your more blood pressure. So it's not all patients that have high blood pressure that we place on drugs. Thank you very much. So you just need to talk to a doctor for a second opinion.
Thank you very much, Dr. Benjamin. Another question. The participant had high blood pressure during pregnancy, and now our baby is almost a year old and is still elevated. What can she do?
That was another very beautiful question. Blood pressure in pregnancy is common. It is called pregnancy-induced hypertension. It's also one of the risk factors for persistent high blood pressure after delivery. Though scientists have found out that the presence of the baby in the womb, because of the sac that surrounds that, there are some cells, we call them trophoblastic cells. When you are pregnant, there's tendency that they interact with your body system and shoot your blood pressure up in pregnancy. That can be treated. Most people recover the moment they deliver, but some are not that lucky. So it's also a risk factor for persistent blood pressure afterwards. What you just need to do is to talk to a doctor. You can be checked if there are other coexisting conditions like renal, kidney problems, such can as well be treated. And if there's any other thing that needs to be done to make sure you are fine, such can be done. But it has been proven that people with such elevated blood pressure in pregnancy who still have high blood pressure post-delivery.
Okay. Thank you very much, Dr. Diram. This next question is for you. So the question says, can the test be conducted online? The person is not clear on how we go about the wellness test. Is it a physical test or it's online?
Okay, there are some of these tests that you can do on your own at home using our device. Like I said, the 6-in-1, you can do quite a lot with the 6-in-1 at home. But there are some that you have to come to our center to come and do the wellness plan, because we are going to draw blood for some. Then there are some that you are going to stand on some of our AI and ML machine, like the joint analysis machine and all that. So it's a combination of the two. For the wellness plan, you need to come to our lab for us to be able to do the scan, the coronary scan, the aorta scan, the drawing of cholesterol. But others you can do with your device. If you purchase any of those devices from us, you can do them and upload it for your doctor to see and advise.
Thank you very much, Dr. Nifadi. So one very last question for Dr. Benjamin. Can hypertension be totally cured?
Very good question. As I said earlier on, there are some classes of hypertension that have an underlying cause. That if there's something in the system that causes that. The commonest of such is when there is narrowness of the blood vessels of the kidney. We call it renal artery stenosis. If that is the cause, if you correct the condition, because sometimes it could be because there's too much cholesterol that is causing the blockage in the renal arteries, or maybe there's a clot, or there's another condition that can cause renal artery stenosis. We call it fibromuscular dysplasia medically. If you are able to treat those, the person might have normal blood pressure. How about too much of cholesterol? How about diabetes? All those things, all those with underlying causes, if you treat the underlying causes, you may cure. But majority, 90% of cases, they do not have underlying cause. So what we normally say, we normally advise is that such patients must be on drugs for life. But let me tell you something from my experience. I found out that it does not apply to all the patients, because there are some patients, after a while, when they're on drugs, we start withdrawing their drugs and their blood pressure normalizes. Sometimes we take the drugs off, they're off drugs, and you give them appointment, keep checking your blood pressure, they keep coming to the clinic, they just come and tell you their blood pressures are fine. So in as much as I'm not going to say what is contrary to what is generally in the text, that you use the drug for life. If you're able to carry your doctor along, you're able to take the advice of your doctor, your dietary approach to stop hypertension, lifestyle modification changes, there's tendency that you won't be withdrawn, because your blood pressure cannot be fine or dropping too fast, and we are still placing you on drugs. We are not treating what is in the literature. We are treating the patient as an individual. Thank you.
Okay, so I've just been informed that we can take about 3 more questions. Dr. Benjamin, that is fine with you. Okay, so a question here says that the person's blood pressure has always been in the lower bands of systolic and diastolic pressure readings. Are there dangers associated with low blood pressure? Then the second one that goes along with this, someone's giving a figure, our blood pressure is 9168. Is it normal?
The blood pressure is like what, Dr. Gloria?
9168. Is it normal? The first one says, are there dangers associated with low blood pressure?
Very good. Okay, the blood pressure of 9160, that one is normal if you don't have symptoms. There are some symptoms of hypotension. When the blood pressure is too low, we call it hypotension. When it is high, we call it hypertension. Thereabout. If the systolic blood pressure is 90 or less than 90, and the diastolic is less than 60, we call that one hypotension. There are some dangers with hypotension. You may be dizzy, you may have low energy, and then you may have fainting spells. In fact, too much of low blood pressure can cause a type of stroke, what we call lacunar infarct. It's a type of stroke. Now, let me say this clearly. There are some people, naturally, they have low blood pressure. We describe those people as being vagotonic. No matter the level of stress they do, their blood pressure hardly rises to a dangerous level. Even when they are seated, they have blood pressure as low as 90, 60, sometimes 90, 50, and they don't have symptoms. Those individuals thereabout, once they don't have symptoms, we don't bother treating them, and we just reassure them, and we don't do any other thing. But if it is unduly low because of some conditions, maybe too much of BP drugs and all of other things, those ones have their dangers, which I talked about earlier.
Okay, thank you very much. So our very last question, thank you for staying with us. Does high blood pressure have anything to do with menopause?
Wow,
or premenopause?
Okay, premenopause. Well, it has not been scientifically proven that high blood pressure could cause maybe early menopause or not, or could have any other issues. That's not been scientifically proven, except there are other conditions that can affect that. But as far as the literature is concerned, there has not been an association between the two.
Okay. Thank you very much, Dr. Benjamin. Thank you, Dr. Diron, for your time. It's been an enlightening session. So our attendees, remember we said first 10 participants get a free foot scan. And so just to call some names, we have Irene Bello, Onoche Martins. The remaining 8 will be sent an email, so you can always come to our office at Adol House, CIPM Avenue, Alausa, Ikeja. So for the other question on where our center is for the lab test, that is also where it is, Adol House, CIPM Avenue, number 15, Alausa, Ikeja. And so thank you once again, everyone, for joining this webinar. So our football enthusiasts, do enjoy your match, and to the rest of us, have a good evening. Thank you.